Endocrine-induced muscle disorders. Endocrine-induced muscle disorders include corticosteroid myopathy, muscle disorders and hyperthyroidism, muscle disorders and hypothyroidism, muscle weakness associated with osteomalacia, and hypokalemic myopathy. Corticosteroid myopathy. Corticosteroid myopathy results from prolonged corticosteroid therapy, usually given for conditions that also cause muscle weakness, such as myasthenia gravis or inflammatory myopathies, or from conditions associated with elevated corticotropin levels, such as Cushing's disease. The incidence of muscle weakness ranges from 2% to 20% in those receiving long-term corticosteroid therapy, and from 50 to 80% in those with Cushing's disease. Symptoms and signs. Muscle weakness usually begins in the hip girdle, especially the quadriceps, and eventually spreads to nearly all muscles, though the proximal muscles tend to be most affected. In chronic corticosteroid myopathy, muscle wasting is often apparent, though exercise decreases it. Muscles supplied by cranial nerves other than the neck flexors are spared. Occasionally, patients experience mild aching in the thigh muscles, but severe pain does not occur. Tendon reflexes remain unchanged, and no fasciculations develop. Patients often complain that they become fatigued more rapidly during activities demanding sudden bursts of power. Diagnosis and treatment. Typically, serum creatinine kinase and other muscle enzyme levels, electromyography studies, and nerve conduction studies are normal. Muscle biopsy often shows striking atrophy of type 2 fibers. If the patient has inflammatory myopathy, decreasing the corticosteroid dose increases creatinine excretion and muscle weakness worsens. The treatment of corticosteroid myopathy is empiric. The only certain principles are to reduce the corticosteroid dosage gradually and monitor the patient closely. Complete recovery usually occurs in 2 to 3 months. To reduce the likelihood of corticosteroid myopathy, many authorities recommend switching to alternate day corticosteroid administration as soon as feasible. And that's endocrine-induced muscle disorders.